All right, today we're going to talk about a drug that is, no joke, an absolute cornerstone of modern medicine. It's used every single day in hospitals all over the world for everything from calming nerves before surgery to stopping life-threatening seizures. But what makes it so special is this really brilliant piece of chemistry.
So let's start with a puzzle, one that kind of messes with your head a little bit. How can a single drug act like it has a split personality? How can it be one thing inside a glass vial and then transform into something completely different the second it hits your bloodstream? The answer to that question is exactly what makes midazolam such a medical marvel.
Okay, let's get right into it. The secret to midazolam's incredible power lies in this super clever piece of chemical engineering that people in the field call the midazolam trick.
So first off, what is this stuff? Well, midazolam belongs to a family of drugs called benzodiazepines. Its whole purpose in life is to provide really potent but short-term sedation to slash anxiety, and this is a big one, to cause amnesia, so you don't have to remember uncomfortable medical procedures.
Now this is where the magic happens. This slide breaks down the midazolam trick. It all starts in the vial, where the drug is kept in an acidic solution. This keeps it water-soluble, which is great because it makes it super easy and painless to inject. But the real genius kicks in the moment it enters your body. See, your blood has a neutral pH, and that change in environment acts like a trigger. The drug's molecular structure literally flips, and it instantly becomes fat-soluble. And that is the golden ticket. This new shape allows it to slip right past the bouncer, the blood-brain barrier, with incredible speed and get to work within minutes.
So, the drug has done its little shape-shifting trick and made it into the brain. Now what? Well, it's on a mission. It's looking for the brain's master off switch. And that off switch is a neurotransmitter called GABA. The easiest way to think about GABA is as the brain's natural brake pedal. Its job is to pump out these calming signals that keep all of our neural activity from just firing wildly out of control.
But here's the really crucial point. Midazolam doesn't just stomp on that brake pedal itself. It doesn't activate the GABA receptors on its own. Nope. It does something much, much more subtle and way more powerful.
Think of it like a volume knob for calm. On the left, you see what GABA does all by itself. It opens up a little channel on a neuron, which makes that neuron less likely to fire. It's the brain's natural simmer-down signal. But now look at the right, when midazolam shows up to the party. It doesn't open a new channel. Instead, it just makes the existing one way more effective. It causes that channel to open up much more frequently, which dramatically amplifies GABA's natural calming effect. It's like turning that volume knob all the way up to 11, and that's what brings on that powerful sedation and relief from anxiety.
And this whole journey is unbelievably fast. When it's given through an IV, the effects kick in within just a few minutes, and they hit their peak almost immediately after that. But here's the other key part. Look at the duration. It's only about 1 to 2 hours. This short action is exactly what doctors want for medical procedures because it means patients can recover quickly once everything is done.
So when you put it all together, that rapid onset, that potent effect, and that short duration, it's pretty easy to see why midazolam is such an indispensable tool in any hospital setting.
I mean, you see this stuff used everywhere. It's the go-to drug for conscious sedation during procedures like colonoscopies. They give it before surgery to help calm patients' nerves. It helps kickstart general anesthesia. And critically, because of how powerfully it calms the brain, it's a first-line treatment for stopping those incredibly dangerous non-stop seizures.
But, and there's always a but with something this powerful. A drug like this is a total double-edged sword. The same mechanism that produces such a profound, deep calm can also be incredibly dangerous if it's not managed with extreme care.
Let's be crystal clear about this. The single most dangerous side effect of midazolam is respiratory depression. And we're not just talking about feeling a little sleepy. This drug can literally suppress your body's most fundamental, hardwired drive to breathe, to the point where it can just stop completely. That's a condition called apnea, and it is a life-threatening emergency.
And that risk? It skyrockets when midazolam is combined with other drugs that also slow down the central nervous system. I'm talking about opioids like fentanyl or morphine, or even things like alcohol. That combination can be absolutely deadly, which is why this drug is only ever used in a setting where a patient is being closely monitored.
And it's not just about breathing. It can also cause a big drop in blood pressure. And weirdly enough, sometimes it does the exact opposite of what you'd expect and causes agitation, especially in elderly patients. And that amnesia we talked about, while it's often a benefit, it's still a side effect that patients need to be aware of.
Now, certain groups of people are way more vulnerable. The elderly, for instance, are much more sensitive and need much lower doses. People with liver or kidney problems can't clear the drug from their system effectively, which means it can build up to dangerous levels. And for someone with sleep apnea, the risk is incredibly high. And then there's this last one, which is a critical interaction to watch out for. A lot of common medications, and hey, even grapefruit juice, can block an enzyme in our body that's responsible for breaking down midazolam. If you block that enzyme, the drug's levels can just soar unexpectedly.
So with all these serious risks on the table, how do medical professionals manage its power and keep patients safe? Well, there is a safety net, but even that comes with its own warnings.
Thankfully, in a situation where someone has had an overdose, there is a specific antidote. It's a drug called flumazenil, and it works by essentially competing with midazolam. It swoops in, knocks it off the GABA receptor, and reverses the sedative effects. It's like an emergency eject button.
But here's the catch, and this is a big one. Flumazenil's effects wear off faster than midazolam's do. This means a patient can wake up, seem totally fine, and then they fall right back into that sedated state once the antidote wears off. This is exactly why continuous, close monitoring is absolutely critical, even after a reversal.
And this really gets to the heart of it all. Midazolam is an incredible, incredible tool. In the right hands, it provides immense benefits, making countless medical procedures safer, easier, and more tolerable. But its power demands constant vigilance and the utmost respect.
Which leaves us with a final thought. We have this key that can unlock a state of deep calm and amnesia, making so much of modern medicine possible. The ongoing challenge for every single medical professional who uses it is how to continue to wield that key with the profound respect that its power demands.